So DVTs, do you know what that stands for?
Deep vein thrombosis.
Yes, perfect. So deep vein thrombosis. Why do we stress these so much? Like, what is the scary part with deep vein thrombosis?
Because if it's dislodged, it'll kill them.
Yes. So if you have a clot,
if it becomes an embolus.
yeah, if it dislodges and becomes a pulmonary embolism. So risk of a clot is it could dislodge and turn into a pulmonary embolism. Perfect. Okay. And obviously you can stop breathing because it's just like blocking. Okay, so what are the three main, like the triad signs and symptoms that you kind of look for? That you would observe in someone who kind of had a clot.
Wouldn't they have like hot spots? Or?
Yeah, hot spots. So it would be warm. What else?
Would they have edema?
Swelling, yep. There's one more.
Would it be edema specifically or just swelling?
Just swelling mostly. Okay. One more. It has to do with their color.
It'd be red?
Yep, redness, perfect. So that's why in your assessment, before you do the Homan sign, you look for any hot spots, you feel for that, you look for any red spots, you see if it's swelling at all, and if it's not, then you go ahead and do the Homan sign, because if you were to do the Homan sign, and they did have a blood clot, you could dislodge it.
So the Homan sign looks for a blood clot, right?
Yeah, but they're not using it like in hospitals anymore. They're just finding it's not actually that helpful.
Well, I just don't
Sister Ward said that though, right?
Yeah, it's just like you're checking for hot spots. I don't get why you would want to like do a test for something that could hurt.
So like I said though, you don't really use it in the hospital. Like you're kind of trying to stray away from that. But definitely remember like the three signs and symptoms that you want to keep with. Those are huge. Okay. So okay, let's start with this. What kind of patients do you think would have risk for or develop blood clots?
Ones who have atherosclerosis?
Yep, because it could break off. Huge one is immobility.
Yeah.
Because the huge thing is, if your blood is just being stasis and not having any venous return, it's just staying there, it can clot. That's why with like AFib, if it's not going out, it can clot. That's why circulation is so huge, but immobility, they don't have circulation. Surgery, kind of the same thing. They aren't able to get out of bed as easily. Hypertension is huge. You get blood clots. Atherosclerosis. Can't say I spelled that right, but I might have. Oh, yeah, I think it's nice. Anyway, true, because it can break off. Basically anyone who's just sedentary. Okay. So, now that we know that these are the kind of patients that could get it, we have nursing intervention. So, like, what kind of things do you think you would do for this patient? Or prevention, so nursing interventions or prevention?
Ambulation.
Ambulation's huge, and why?
Because if you make sure that they're not immobile, you won't get the blood pooling and clotting.
Yeah. And just increase circulation, right? What are some like mechanical or just like devices you can?
The CV.
SCDs?
SCDs.
Here, we're gonna spell this out. So I think it's sequential compression. Just make sure I spelled that right. It's like a Harvard sequential compression device. Okay, yep. So that's what SED stands for. So like I said, it's like the pulsating movements, increasing venous return. What kind of socks? It's kind of like a TED hose, right? Because that's going to increase venous return. What could position do you think you kind of have your legs at?
Did you elevate them?
Yeah, elevate legs. Perfect. Just to kind of, like we said, promote venous return. Okay. What kind of medications do you think you'd give someone who's at risk for?
Like a blood thinner?
Yeah, so that category is called anticoagulant. Just prevents the formation of clots, so that's preventative. Yeah. So basically, nursing interventions all fall under. You want to increase the return of the blood, so keep the circulation going, keep the blood moving so they don't stay.
So increase venous return?
Yeah, because DVT, deep vein thrombosis, so it looks like this. Increase. Okay. Make sense?